Hi everyone. Today we're going to be looking at educational assessments because this is an area that I feel that we can't discuss enough about. Working with neurodiverse learners calls for a collaborative effort. And one of the things I do say to parents is that as an inclusion consultant and as a teacher, I can help you develop and implement an intervention program. What I cannot do is I cannot assess your child and tell you exactly what areas they may be struggling with or even give you a possible diagnosis. There's no professional that has it all figured out. So while I develop programs that build cognitive skills, I'm not a speech therapist, I'm not an occupational therapist or an education assessor. And so today we're going to be looking a little in depth into education assessments through Scilla Allen. As you know, Scilla and I work together quite a bit. We have run the redefining inclusion sessions together that we'll be talking a bit about at the end of this. And we've developed the 8 principles of inclusion that we're hoping should grow into something a little bit bigger in the next few months. Scilla is an education assessor that I often, if not always, refer my parents to. And one of the reasons is that not only is she thorough, but I feel like she doesn't use a rubber stamp approach. And what do I mean by rubber stamp approach? Sometimes I find that there's the easy labels, ADHD, ASD, dyslexia. And sometimes it feels a little bit like children are assessed with these rubber stamps and they've got to be one or the other and there's nothing else to it. However, after working with Scilla, I've seen that she looks deeper and doesn't just stop there. And more than often will see and come across an aspect that no one else ever really thought about. So Scilla, welcome and thank you for being with us today.
Thank you. Thanks for inviting me. It's really nice to have this conversation.
Great, perfect. So to begin with, please tell us a little bit about your background and what got you into education assessments.
So I've been in education probably for close on 40 years now. I started in mainstream education for the first 15 odd years and then found myself in a situation where there were too many kids in my class that I couldn't pinpoint what was going on. I ended up doing a master's in special ed and focusing then into both working with kids that had specific learning difficulties. Um, that really has been my focus for the last 20, 25 years. First of all, working with children directly, but then also starting to work more with the parents and the teachers. And that's really when I stepped away from the classroom. I felt that the people around the child needed as much help as the child did themselves. But assessing the children and understanding where the breakdown was happening and why the breakdown was happening was always a really particular area of interest for me. More recently, I'd say the last sort of 10 years, I found increasingly that not all the pieces were coming together, which is what led me to start my doctoral studies as I looked into and understood the impact of mental health and the challenges of mental health and how on paper all the academics and potential and processing and everything looks fine, and yet the child is not succeeding. And often it's that mental health aspect that is causing a breakdown. So that's the focus of my doctoral studies at the moment.
Yeah, I'm really excited to hear how that, what comes of that. I find
Mm.
Scilla and I speak very regularly and we're almost like friends, but unlike friends who talk about what the latest gossip is, our conversations are always surrounding education, but it's not professional. It's almost just, I think, something that we share. And so I'm really excited to see what comes out of your doctoral studies and just, yeah, what that brings to the plate. So very exciting. So sort of we've worked with a few kids, the same kids. We've had mutual clients. And one of the things I've noticed when parents come to me with an assessment that's done by you, as opposed to assessments that have been done by other assessors, is that there are numerous tests that you do. Typically, I see maybe an assessor doing 2 tests, maybe 3, but your bare minimum is 4. And sometimes I've met kids who've been assessed through you who've come with a battery of 6 to 7 tests being done. Why so many? Do you have a reason why because that's got to be more work for you as well. Is there a reason why you do as many tests as you do with a learner?
Mm. Certainly one of the biggest challenges is you want to get, because information, knowledge is power. So I want to get as much information as I can, but I can't expect a child to sort of, survive a 8-hour assessment session. So I try and keep it to 5 hours over 2 days. And in that time, I really work to try and get as complete a picture of the child as I can. And there are different tests that have different approaches, different strengths, different requirements, but it's really just, I've learned that what gives me feedback and what gives me understanding and what gives me information. And I may assess the same skill, if you like, with using 2 or 3 different tools because they approach it from a different angle. And by then putting all of that information together, I've got a much fuller understanding of where the breakdown is happening and why. So yes, you can do a quick cookbook, and things like the exam access assessment is purely and simply there to provide the evidence to support an application. So there's no diagnostic focus there. And it's a very different approach to if I'm trying to understand what is going on with the child and why. And because there are often situations where people are assuming that they know what is breaking down and why, I need to be able to have a neutral, objective approach to understanding. And I need to really be able to apply the knowledge to the child. So when I'm doing an assessment, I will actually usually take a photo of the child so that when I then do the assessments, I've got that person there in the room with me and my notes, I write copious notes while I'm doing the assessment. And all of that information, the assessment, the anecdotal notes and records that I have, the background information that I take from the parents, the background information I get from the teacher, and then if we feel that we have concerns that there might be an attentional or behavioral or executive functioning issue, then the behavioral supplement comes in as well. Sometimes even, especially if the student is older, I may often take in some information through a questionnaire for self-concept and understanding of where the student's coming from, so that I've got as much information and data as I can, that I can then look at how they are impacting each other, how they're working together, how they're working against each other, what's causing the breakdown.
Yeah, yeah. So when you have different assessments, let's just put the behavioral one aside. Does it change for parents if they sign up for an assessment that you thought would call for 4 tests, but you find that they ended up having to do 5 tests? Do you just go ahead and do it under that? Do you know what I mean?
No, I do, exactly. So I have my baseline battery. Sometimes I will, and those batteries, so for example, the BAS has got, a whole series of assessments that I do, same with the KT. But there are some tests in the KT that I won't bother to do with the child because I already know, maybe I know already that they have a high vocabulary. And I also know already that they have a very low reading ability. Therefore, assessing their reading vocabulary may not be relevant because it'll be the mechanics of the reading that's interfering with their vocabulary, not their language. But if I've got a child that has a strong reading language but has a low verbal ability, I may well specifically do the reading vocabulary because I want to see whether it's more of a word knowledge or an analysis or an expressive language that's causing the breakdown rather than the mechanics of reading. So it's really each report, each assessment I do really does inform me on where I'm going to go next with the assessment. If there's a breakdown in the memory system, I need to know why and where and how. Is it the visual? Is it the verbal? Is it the integration of them both? Is it the context? Is it the isolation? Is it the attention to detail? It's all very well saying they've got a problem with memory, but memory is a huge issue. And I need to know really specifically where the breakdown is happening so that I can inform parents and teachers as to how they can make intentional interventions to support their child.
Yeah, yeah. So I'm hearing you say things like Katie and names like that. So could you give us a very brief on what the commonly done assessments are and what families should expect when they sign up for their child to get assessed by you?
So the first thing I do is look at the core potential. What can we expect this child to be able to achieve? And that's kind of like saying, what size engine do you have in the bonnet of your car? Is it a VX or is it a bottom, a VW that's parked in the garden? Because that has a huge impact on what we can expect the child to perform. If your child has a VX in the car parks in their brain, and yet they are not meeting grade level expectations, what is going on? Why is there a breakdown in that learning? So knowing and understanding their potential is a really big part of it. And of course, ability is got many components to it. And some of those components are influenced by environment and some are not. And we need to know what's going on there. So core potential ability is a really important part of it. Another aspect is it's all very well having that potential ability, but if you don't have the processing systems that you need in order to access that potential, then you're not going to be able to take advantage of that. So your processing speed, your memory systems, all those processing systems, we need to understand what's going on there. You've then got the aspects of, all right, I've got the potential, I've got the processing systems, how are they coming together to support my learning? Have we got issues going on with attention? Have we got issues going on with sensory integration? Have we got challenges with motivation? Have we got challenges with mental health? All these things that might be interfering with how those issues are integrating to work together. So when I'm looking at an assessment, I have my baseline and I build on that. And it might be that sometimes I might say, I need to look beyond the core ability and the processing to something like behavior or sensory. And I might ask the parent if I can add more to the tools. So the British Ability Scales gives me the baseline and some of my initial assessment of processing systems. The KT is a much more comprehensive evaluation that then looks into achievement, and I can then compare what I would expect the child to be able to do and what the child is actually able to do. It also gives me some information on memory and processing. With this last year that we've had, I had to really change a lot of how I was working, and I had to work quite hard to create a tool that allowed me to work with children independently or remotely. So I did actually then start creating an online assessment tool. And Pearson, who produced a lot of the testing material, were fantastic at helping us adapt and create a valid assessment tool that meant that we could carry on doing our assessment work online. So that opened a lot of other doors. It meant that rather than having to find 5 or 6 children in Uganda or Tanzania to go and assess, I could actually just assess one because I didn't have to pay all the travel and the accommodation on the extra costs. I've assessed children in the UK, I've assessed children in the Netherlands, I've worked with children in South Africa and Eswatini and all over the place, Dubai. So really, I've become far more international, And I'm really comfortable doing that because I believe that my qualifications have allowed me to do that. So my qualifications are mainly focused on the UK and the British system, with the assessment practicing certificate being the key one, which shows that I have done the qualifications necessary to offer those assessments that are necessary for diagnostic, for behavioral, but as much as things like educational assessments as well. It's an international assessment qualification that anywhere I go, I can show them that I'm registered with the British Psychological Society, and I can show them my APC qualification and hopefully soon my PhD as well, so that they know that I am qualified and that I am coming from a position of information. And the nice thing about the APC is we have to update it and maintain it every 3 years, which means we have to do so many hours of professional development and credits to make sure that so they are happy and they are confident that we are maintaining our standards while we do the assessment.
Yeah, super. I'm hearing you say that this is UK based, but I know that you have taught in the American system and that you work with a lot of kids across the globe. And I find that in my practice, especially because of the past year, that international outreach is becoming more prevalent, which is really great. And I find that personally, I'm encouraging parents as much as possible to have that child assessed, because it helps me as a consultant to know how to develop that program, considering where the child needs support, where their strengths are, and if there's a behavioral component, then I'm able to draw on a behavioral assessment that's done by you or an assessor, for me to know what the right systems are that we need to put into place and how we can manage expectations. And I still find parents saying, well, what value does it add? And I sort of say to them, you'll understand your child, you'll be able to advocate for your child, and academically the child can have arrangements put into place, like extra time or a reader, assistive technology. But that's just from my point of view. I'm interested to know from your point of view what you find that the assessments have helped with in terms of breaking down misconceptions, improving the understanding of a child, because you work with, numerous kids. I only work with 5 or 6 at any given time. So I'd really like to hear about what other benefits are you finding are coming out of having a child assessed?
Knowledge is power. And by understanding where the breakdown is happening, we can get rid of an awful lot of assumptions that are impacting on that child's life. And I've had some really tragic cases where I've assessed a child at 15 or 16 years old, and the parents and the teachers and everyone kept saying, oh, he's got really bad attention, really bad. He can't pay attention. He's got ADHD. I then assess him, and it's very clear to me this child has no problem with paying attention at all. What he does have is a really, really compromised processing speed, which means that he is paying attention. He's just 2 steps behind you each time. So when you go ask him a question, he goes, what? It's not because he wasn't listening. It's because he can't keep up with you. And this child's mental health situation was on the floor by then, because he'd had all those years of people saying, you see, you're just not paying attention. And yet he was. So often what the assessment does is give me the knowledge to then explain to the parents where the breakdown is happening and why. The amount of times I've had parents go, oh, well, I don't need to have an assessment. He's got dyslexia. I know that. And if I go, why? They go, what do you mean, why? And I go, why has your child got dyslexia? There are many roads that lead to dyslexia. It's all very well knowing that they've got dyslexia, but if you don't know why they've got dyslexia, you don't know how to intervene. You don't know how to support their needs. So an assessment helps us unpack their learning challenges, helps us understand why there is a breakdown in their learning, and gives us the information we need so that we can make that targeted intervention and allow them to be successful in their learning, or develop and provide the accommodations they need to compensate for their learning challenges.
I think the common thread is we just want everyone to understand these children better and support them better. And that's really what we need to push for. And that brings me to the final point that I'm just going to throw in, is talking about our redefining inclusion sessions that we recently improved and we hope to continue improving. And you know, so one of the things that I find is that while the sessions are not looking to turn a parent or a teacher into a consultant, that takes years. I mean, I've been doing it 15 years. I still feel like I'm still trying to figure it out. So we're not telling parents that, you know, do this 7-8 week course, you're going to become a consultant. No, but we are seeing that parents and teachers are better understanding their child, and that's helping them understand your role, my role better, and be better informed rather than being at the mercy of consultants and assessors. And it just, I find that it is bringing an interesting, you know, energy into the intervention program, because as you said, knowledge is power. And I'd like to know, what has been your big takeaway from the redefining inclusion sessions that we've had last year?
I think it's seeing parents and teachers develop the vocabulary to express their concerns and their understanding. And by giving them that voice, they're able to engage with the other parties in the room, so that everybody is working together to support the child. And because they're coming from an informed situation, you don't get that defensiveness, you don't get that conflict. Everybody feels more empowered, and everybody is more able to come to the table and meet the child's needs rather than fight their own corner. So I think inclusion is about collaboration. It's about intentional intervention. It's about empowerment. And I felt that our course gave people the tools that they needed to build on and develop that understanding and figure out a way to go forward.
Definitely. Super. So if anyone would like to get in touch with Scilla, you can find her on the Friends tab of my website. I'll also put in her website details, and so you can always reach out to her. If anyone wants to sign up for our next Redefining Inclusion course, we've now moved it to, we used to have 7 1.5-hour sessions, but now we've scaled it up to 8 2-hour sessions. And so if you want to sign up for that, you can find a link to the Redefining Inclusion page. Just to let you know, it costs £200, and you get your 16 hours of training plus 8 hours of open office sessions, where you can access Scilla and my support. You get a 5% discount on any educational assessment and a 1 year's PAGS license, among a number of things. So just check it out on the website and just,
it's a really good deal.
Yeah, I think it is, because I think about my hourly rate. I think that, you know, parents would probably get 4 hours out of me, but here we're giving them 16 hours of both of us. So that's going to be starting on the 15th of April. So please have a look at that. Reach out to Scilla and continue supporting, advocating, and learning your child as much as you can. It just makes you happier and makes you celebrate your you know, your child and their success even more every day. Yes, so everyone have a nice rest of the day.
I think, you know, knowledge, understanding your child's learning can only add to your toolkit. So don't feel threatened by a suggestion for an assessment. It's a positive step forward, not a negative one.
Yeah, definitely. All right, everyone. We look forward to hearing from you all. Have a great day. Bye.
Bye-bye.